Edo Governor Godwin Obaseki and the United States Consul General Will Stevens on Tuesday, May 21st, commissioned the Edo State Public Health Emergency Operations Center (PHEOC). Obaseki, during the commissioning for Palm House along Sapele Road, Benin City, the Edo State capital, said the facility will serve as a hub for health situational awareness, daily epidemiologist intelligence gathering, risk analysis of emergency events of public health importance which they needed for decisions making. The governor said the center an initiative will underscore him administration's sustained efforts to strengthen health institutions for real-time emergency and disease management for the state. He talks say,
ensure adequate surveillance data on disease conditions, especially those priority diseases which we are tracking in Edo, like measles, Lassa fever, cholera, COVID-19, diphtheria, yellow fever, monkeypox, etc., and other emerging or re-emerging diseases. It also will serve as a hub for public health situational awareness, daily epidemiological intelligence gathering, and risk analysis of emergency events of public health importance which are needed for decision making. We believe that institutions such as these are critical in preempting and managing crisis, especially that data is readily available to study trends, spot outliers, and prepare for effective response in matters of emergency. We saw this during COVID. That was what informed our openness and willingness to receive support to set up an institution like this. The COVID-19 pandemic brought to our fore the need to strengthen prompt response to public health emergencies, outbreaks, and other priority diseases of public health importance. The Edo State Public Health Emergency Operations Center was set up in 2020 during COVID after several months of painstaking work by myself, NCDC, USAID, and was declared open by a friend and a very dedicated health worker. It is worthy to note that the Edo PHEOC is one among few in the country that has been upgraded to address the public health events, integrating disease surveillance and response, routine immunization, and review of all public health data for informed decision making. The Edo State government wishes to express her gratitude again to the USAID, Data FI, for the support given to the state over the years in improving the health of Edo residents.
For him part, U.S. Consul General Will Stevens say, now the job of government to take care of the people, and said the facility is a great symbol of democracy delivered by responding to the needs of the people and making the people happy and safe.
It's the job of government to take care of its people. And today I think this is a great symbol of democracy delivering for people, right? Responding to the needs of the citizens and working to make us all a little bit healthier and safer. And we in the United States government are so grateful for the health partnership that we have with Nigeria. For nearly 25 years, through the PEPFAR program, the President's Emergency Plan for AIDS Relief, the United States has worked together with Nigeria to stop the spread of HIV/AIDS in Nigeria and then really get very, very close to, if not at, epidemic control here in Nigeria. And that is only due to the incredible work of our partners like Data FI, Health Alliance, WHO, and the commissioner here and the team here.
Commissioner for Health, Dr. Samuel Ali, for a welcome address, say the center will serve as a nerve center facilitating real-time communication and data sharing amongst health professionals and epidemiologists.
The strategic operation of the EOC has led to case positive report showing a reduction from 23% to 1% for Lassa fever cases in within 12 weeks. So all of these are part of the insight that gather preventive strategies and improve our response capabilities. So we are gathered here to formally commission this Integrated Emergency Operations Center. This building will offer integration with various health agencies and departments, just like our governor was saying earlier, ensuring a coordinated and unified response to health emergencies. The center will serve as a nerve center, facilitating real-time communication and data sharing among health professional epidemiologists.
Make it no forget, say, as we see them, now so we they talk we know they take blame. From Benin City, Balomi Mukoro, TMC TV News.